Okay, yeah, welcome to Azay Media,
Yes.
Super Cooper. How are you?
Good, good.
Oh, wow, looking great.
Ah, you too, man.
Oh my God, look at your hat. Woo! You matching everything. Look at
Yes.
you, man. Look at everything. Everything is always matching. You know, black and then what color is the wine? Gold, burgundy, and everything. Wow.
Yeah.
Okay. Anyway, before we see, how do you think about the show? The show that people. You sure people really liking our program?
Oh yeah, for real.
Oh yeah.
Yeah, they're really liking the show, Matt.
Oh yeah.
Yeah.
And today, happen that we're going to talk about the health, related issues, and then the doctor is coming to talk to us, advise us what to do.
Oh, that's really great.
Yeah.
That's,
So, and then you are aware of it, right?
Oh yeah, it's something that we could benefit from.
Exactly.
In the community,
Dr. Rita Luard, from
Dr.
the
Rita Luard.
Yeah, Rita Luard from Montefiore Hospital, right?
Yes.
She'll be practicing for a long time.
I know she's really good. She's really great.
Oh,
at what she does.
I heard that she's wonderful. She's very wonderful.
Yes.
And then the appearance, the way she relates to you, the way she smiles. We like people like that in our community.
That's true.
Yeah, we like people like that in our community. Sometimes you go to places and the doctors, they don't, but some people do very great, right?
Yes.
And then diabetes is bothering people, but some of us doesn't know, right?
I know.
Like me, I don't know. I have no idea about those things.
Oh, you have to get tested.
Oh yeah.
Yep.
Oh, you have to be tested.
Yes.
To know that
you can have it and don't even know.
You don't even know.
Yeah.
So wow, that's true. So everybody need to be, to be aware of all these things.
Well, it's good that we have health-related programs, positive message, health-related. This way, we can help educate the community about things.
So the sickness goes down, right?
Yeah.
Sometimes it's what we do, we don't know. We do this ignorantly, and then we fall into problems.
Yep.
So that's why we try to, let a doctor to educate us so that we can be able to live right.
Great.
And do things in the right way. So anyway, we don't want to waste too much time of our audience, and then doctor need to come to talk to us.
Yes.
So that we can be able to let this program roll on. Cooper,
yeah.
Thank you meeting you, and I know you are a wonderful brother.
Yeah, you too.
And then keep in touch. Yes,
for real.
So it will be wonderful.
Yeah, it's always good to come by.
Yeah, thank you. Yeah, welcome back to Azay Media. As I promised you that we have a great doctor in our midst who have been working in our community for so many years. Dr. Rita Luard, director of the Clinical Diabetes Center at Montefiore Medical Center. This lady, she's been a blessing to our community, and she's wonderful the way she cares for our family. That's why we invited her to come and tell us something about our health, to educate us to how to comport ourselves, what to do, what not to do. So I just wanted to stay tuned and call a friend and family to watch this program. It might help you, because without healthy life, you cannot enjoy this life. So just stay tuned, and then we invite a doctor to come and talk to us. Dr. Rita, how are you?
I'm doing quite well.
Nice meeting you.
It's been a pleasure.
Wow, you're looking wonderful.
Why, thank you.
It seems like we're matching. Look at the colors.
Know,
I know. Is it coincidence or it just...
It is a wonderful coincidence.
Oh, wonderful. Yes. God is wonderful.
Yeah.
Oh, wonderful. Today we have some few things to ask you. We learned that on behalf of the community, we would like to thank you so much for how you've been a help for our family who have been suffering from diabetes and this and that. We'd like to thank you so much for helping us. Thank you so much for being there for the families that are crying. Number one, to ask you a question, what is diabetes?
Well, I'm so glad you asked.
Okay,
this is American Diabetes Month, which is a time that we can get together and talk to the community about what diabetes is and what we can do to treat or prevent it. So diabetes is a metabolic disease that is associated with high blood sugars. And these high blood sugars can have bad consequences for the body. We have two types of diabetes. There is type 1, which is a type that usually affects younger people, but not exclusively young people, and it's related to the cells in the pancreas not making enough insulin. There's another type, which is type 2, which is what the majority of people have, which is this diabetes that we see related to gaining weight, becoming more physically inactive, and particularly in families that have a tendency to get this form of diabetes, it can be a problem. So there's a type 1
and type 2.
A type 2.
Wow. So what are actually the sign of diabetes? What do you see to see that you're having a diabetes?
So the body doesn't really like those high blood sugars. And one of the things that we do when the blood sugars get high is we like to drink water to kind of dilute the effects. People tend to go to the bathroom a lot more because of these high blood sugars. They can have problems with their vision will get blurred. They can have problems sometimes if it's really high where they lose weight. So those symptoms, going to the bathroom more often, feeling more thirsty, visual blurring, sometimes not healing well or getting more infections can all be signs. Of
that's the sign. Oh, yeah. Wonderful. So in that case, what can we do to prevent certain things like that to happen?
I am so glad you asked me that, because that is one of the things I really want to focus on. Just because diabetes runs in your family doesn't mean that you have to get it. And one of the things we can do to prevent ourselves from getting diabetes is not to gain weight, because there's a clear association of diabetes and being overweight. So that's one thing to do, to actually start thinking about what you're eating and eating healthier, having those 5 fruits and vegetables per day. Things like that can really be a way to prevent diabetes.
Wow.
The second thing is being more physically active. And so I think, we all have this tendency, because it's so easy to take the car and not walk, and to use a lot of things that save time but also save energy. So we tend to be a lot more sedentary, particularly as we get older. So to fight that, what we're suggesting people do is to walk or do some kind of physical activity 30 minutes a day, 5 days a week. These are things that have been shown in studies to prevent people or delay people from getting diabetes.
Okay. So is it a diabetes is it from the genes?
So we do believe there is a genetic reason why many people carry the tendency to develop diabetes. Not all of these people are going to get that. So it's probably going to be an interaction of the genes and the environment that leads to diabetes.
So mostly you can be able to get it through the food we eat.
So it's not the food per se, but it's the food that leads to you gaining weight. That will be the problem. So there's no particular food that I say people need to avoid, although fast foods, sodas, may be a problem.
Okay.
However, it's the weight gain that can lead to the diabetes.
Oh my goodness. So is it possible for anybody to get diabetes?
So is it possible for anybody to get diabetes? What we're seeing is a real epidemic in terms of diabetes.
Okay.
And it is quite sobering that we now have 24 million Americans who have diabetes. We in the Bronx have the highest rates of diabetes of all 5 of the boroughs. So we have higher rates of diabetes, higher rates of complications from diabetes. So it is growing as an entity, this disease, diabetes. But the thing that I find very sobering is that if we look at the current trends, if we don't do something to prevent this disease, 1 in 3 Americans will have diabetes by 2050. 1 in 3. So, I mean, it's just escalating. So to the question, can anybody get it? It's going to be pretty much if we don't do some things to really work on prevention.
So that means exercise means a lot.
Exercise is so critical.
Like we sweat?
Well, I would like people to start by walking. I would like people to start by perhaps not taking the elevator from floor 1 to floor 2. I would like people to start with the small things, because if you incorporate that into your day, it's going to be so much easier to sustain it, right? Not everybody has to join a gym, but walking around their block.
That's your own gym right
Walking
there.
up and down their stairs. These can be really helpful.
That's a gym right there.
That's a gym right there.
Oh, okay. So that means every day we need to see us weights.
Well, every day I want people to walk.
Oh, to
And
work.
I have a pedometer that I usually wear, in which I look at how many steps I take every day.
That's nice.
And my goal is to get to that 10,000
Okay.
steps. But I want people to go more than what they were doing the day before.
Doctor, I don't think you have a problem. Look at how you look. You look very wonderful.
But this is how you do it.
Show us the secret.
Yeah.
You know, so that's the secret you're telling us right now.
Right.
That you be able to walk around, create your own gym.
Create your own gym. I like that.
Okay. So it doesn't mean to go and pay somebody, you know, to go there. Walk around. That's a free gym right there, right?
Right there.
Run.
And what some people do, some of my patients actually get off a stop earlier from the subway or the bus and walk the rest of the way home.
Wow.
So you can start with little things and build them up.
So can it be cured?
No, diabetes can't
Oh.
be cured. Yeah, we
No.
have many researchers
Uh-huh.
and many groups that are looking into a cure. So there are groups like the American Diabetes Association, which is trying to raise money to find the cure for diabetes. But
Oh,
at this
my
point,
goodness.
we don't have a cure.
So what does it destroy on the body?
Well, it can do some fairly devastating things to the body. So if the blood sugars are high and they're not controlled, it can lead to blindness. It can lead to kidney failure. It can lead to nerve damage. It can lead to amputations. So those are the things that will happen if people don't take control. But the good news is, if you do take control, that doesn't have to be your future. And that having diabetes and having your blood sugars in a normal range and having something called the A1C in that range less than 7 means that your chances of getting all of those bad things are much less. And so I've had patients, actually I had a patient the other day who came in and was like, oh my God, I have diabetes, what does that mean? And what it means is that you start taking better care of yourself, right? And what it means is that you start taking your medications the way they're prescribed. And if you do that, your chances of having a healthier, more productive life are drastically increased.
Wow.
And people can actually, believe it or not, feel better because they're doing the healthy things. Right? They're eating healthier, they're exercising.
Wow. Oh my goodness. So what advice do you want to give to our audience, apart from what you just said? What advice, deeply advice that you can be able to echo on it for them to be able to take it seriously? Because you let us know that the diabetes doesn't have a cure.
Not a cure.
You can be able to, you know, suppress it, but you can't cure it.
Right. We can treat it, and we can treat it much better than we could, let's say, 10 years ago. So that's the good news. But I think there are two messages that I want the community to be aware of. The first is that if you don't have it, I want you to do everything you can to prevent it. I want people to start earlier with the healthier eating and the exercise. And I want them to share it with their children, too, because diabetes is starting at younger and younger ages because of the same things. People are gaining too much weight in their teens and sometimes younger. They're not exercising the way they used to be able to do. And so I want people to work really hard to prevent the disease.
Wow.
And this is not just, you know, the individual. I want us to talk to our politicians about making better parks and more parks. I want there to be recreational activities for the adults as well as the children. I want us to think about this as a real thing that we all need to work on, this prevention of diabetes. But the second thing is, if you develop it, it's not the end of the world. In fact, it may be an opportunity to take on a healthier aspect to your life, to think about that exercise and using exercise almost as a medication for diabetes, to think about what you're putting into your body, because your body is a temple, right? And sometimes I look at what we're putting in, I'm thinking we're not really respecting that temple in the way that we should. So I want people to think about healthier eating and working with people to eat a little bit healthier so that they can not only prevent diabetes but also use it as a way of treating diabetes.
Wow. That's wonderful. That's a great education that you give to our community. We thank you so much, Doctor. So you mentioned certain food to eat. Can you put some emphasis on that certain food that can be able to really help us?
So I think many of us have meals that there's absolutely nothing green on the plate.
Okay.
And I'm thinking that's probably not a healthy thing.
So
I'm just suggesting that maybe we should add more green.
Okay.
So that one of the things that people have looked at is how do people increase their fruits and vegetables in their diet. And I'm very encouraged when I walk the streets of the Bronx that I'm seeing a lot more of those green carts, right? Those people who are selling bananas and apples and vegetables on the street, and I think we should all take advantage of that because that's a good thing.
So what do you call, spinach is very good?
Spinach is very good.
Broccoli?
Broccoli is very good. They're all very good.
But some of us have allergic to banana.
Well, there's always apples.
Oh, okay.
There are other fruit out there.
Also, it's the same thing, banana and apple, the same?
I think that the take-home message is that all of us need to increase the fruits and vegetables.
Oh, okay.
That it's a good treatment in terms of preventing diabetes. It's a good treatment for other kinds of chronic diseases like hypertension. We can work on things with diet that would make it easier for your doctors to treat with medication. So it's not just about the pills. It's about what we can do, too, to make sure that we're healthier.
Wonderful. That's great. So, Doctor, how will people get in touch with you?
So I want them to know that Montefiore Medical Center has many different practices and clinics throughout the Bronx in which we're really focused on diabetes. I mean, it's one of our core diseases that we like to impact, and we have not only the Clinical Diabetes Center, which is where I'm working, but other centers throughout the Montefiore complex that are really focused on people with diabetes. So call us.
That's a great concern. That's a very wonderful concern. Wonderful, Doctor. I'm so impressed. It's like, I'm very, you teach me a lot. I learn a lot. Yeah, because I want to lose weight.
Good.
It's
very interesting when people come to me and they say they want to lose weight. They're thinking, they want to be the weight they were when they're 16. But really, losing 10 to 20 pounds can make a big difference in terms of your health. And so you start there, and whatever else you want to do, bathing suit season, whatever, it's good. But you start in terms of the medical benefits. It's not a lot of weight that you need to lose to get that benefit.
I have a few friends of doctors. I say, Doctor, why you don't take medication? He said he doesn't need it. Because he do what? If he's feeling headache, you know that he's tired. He needs to go and sleep.
I think we do need to pay attention to the cues that our body gives us. And I think we do need to pay attention to the fact that although there are a lot of foods out there that are easy and fast, they are filled with calories and fat. And so you want to start the balance. It's all about the balance in life. And so I want people to balance a little bit more green.
Wow.
Yeah.
Anyway, thank you so much. You really make our community feel very proud. And with your service in Bronx community for 6 years, there are so many differences which is going on. The families are happy. The way you treat them, the way you smile. Your smile alone is more than prescription.
Wow. But I want them to take the pills too. No, I'm only kidding. I'm only kidding.
See, so, and then your directions and how you receive people, it is awesome. Please keep the good work.
Thank you.
I know you are doing the work of God. And then, please, we'll pray for you. We continue to pray for God should strengthen you so that you can be able to look out for people out there. Because you feel for them. The families are happy to see you, Dr. Rita. And then we bless that your ministry, your job, to be able to proceed out there. And people should see the good work that you are doing.
Thank you.
So may God richly bless you for coming to Azay Media. Maybe next time, maybe we'll talk about something different concerning the diabetes, and then to educate our community.
Well, just remember, it's American Diabetes Month, so we want people to get out there and start thinking about healthier living and healthier eating.
What do you mean a month? Why is the difference between this?
Well, you know, I think that for many people, every month is American Diabetes Month, but this is one month that the whole country can kind of focus on diabetes. And there's actually a day called World Diabetes Day where the international community focuses on diabetes.
Oh, okay.
And it's just a way to help people to know that there are new things coming on in terms of how we can manage diabetes, but some of the old things like eating healthy and exercising are going to be with us forever. Okay?
I know. Thank you so much, Dr. Rita.
You're welcome.
Thank you so much. I'm so happy to see you in Azay Media. So see you again, okay?
Okay.
Thank you.